हेलो एवरीवन, वेलकम टू साइकेट्रिस्ट लाइफ। मेरा नाम पल्लवी शर्मा है। मैं एक साइकोलॉजिस्ट हूँ। मेरे साथ डॉक्टर राहुल चंदोक है, सीनियर कंसल्टेंट साइकेट्रिस्ट जो 20+ ईयर से दिल्ली एनसीआर में प्रैक्टिस कर रहे हैं। वेलकम डॉक्टर चंदोक।
Thank you, Pallavi. Welcome, viewers.
सो व्यूअर्स, आज हमारा टॉपिक ऑफ डिस्कशन इज ऑन इम्पोर्टेंस ऑफ मेंटल हेल्थ एंड अवेयरनेस इन वर्कर्स, इन हॉस्पिटल वर्कर्स बेसिकली। एंड अब हम जो स्टार्ट करेंगे, रिसेंटली 1 जुलाई को डॉक्टर्स डे गया है एंड आज हम बात करने वाले हैं जो स्टाफ है, जो डॉक्टर्स हैं, जो नर्सेस हैं, जो हॉस्पिटल्स में काम करते हैं, सेटअप में काम करते हैं, उनके बारे में किस तरह से हमें उनकी मेंटल हेल्थ पे फोकस करने का अब टाइम आ चुका है। तो डॉक्टर, मैं आपसे जानना चाहूंगी कि किस तरीके से, क्या समस्याओं के साथ जो हेल्थ वर्कर्स हैं अगर आते हैं तो आपके पास किस प्रकार से आते हैं, क्या समस्याएं?
So, I think Pallavi, ये डॉक्टर्स डे पे डिस्कशन के लिए एक बहुत इंपॉर्टेंट टॉपिक है।
जी।
मेंटल हेल्थ इन हेल्थ केयर वर्कर्स, स्पेशली डॉक्टर्स, इज अ नेग्लेक्टेड एरिया।
राइट।
हर एक को ये लगता है कि ये सब हाई अचीवर्स हैं और खुद उन्होंने हमेशा एक्सेल किया है, तो दे मस्ट बी able to cope with the stress in much better way than the common person.
राइट।
But at the same time, we must have to acknowledge that they are also humans.
राइट।
So anything and everything which can affect any person affects the doctors, nurses, and healthcare staff.
Right.
So they also have their issues in their professional life, in their personal life, in their financial world, which leads to a lot of stress. And people sometimes, when they are in such a area with all the stigma attached to it, they feel a lot hesitant, and because of that, they don't seek proper advice.
Right.
Either they try to self-treat, or they just try to cope it up with alcohol, smoking, sometimes prescription drug abuse. But हर वो चीज, हर वो समस्या जो किसी भी आम इंसान को प्रभावित कर सकती है, वो डॉक्टर्स में भी देखी जाती है। चाहे वो एंजाइटी हो, डिप्रेशन हो, ओसीडी हो, स्किज़ोफ्रेनिया हो, बाइपोलर हो, कोई भी बीमारी ऐसी नहीं है जो मेंटल हेल्थ में डॉक्टर्स या हेल्थ केयर वर्कर्स में नहीं देखी जाती।
क्या इसका प्रेवलेंस हाल ही के पैंडेमिक में या जो वायलेंट केसेस होते हैं अगेंस्ट डॉक्टर्स एंड हेल्थ केयर वर्कर्स, डू यू फील कि इट हैज इंक्रीज्ड ओवर दिस लास्ट कपल ऑफ इयर्स?
देखिए, हमें ये समझना होगा कि मेडिसिन एक ऐसा प्रोफेशन है जिसमें आना मुश्किल, रहना मुश्किल, और एक बार प्रैक्टिस और काम स्टार्ट करने के बाद तो मुश्किल ही मुश्किल। सो डॉक्टर्स की अपने आप से एक्सपेक्टेशंस होती हैं कि हम एक्सेल करते आए हैं तो हमें हर बार अच्छे नतीजे मिले। इट इज बिकम्स, अगर वो पेशेंट्स उस तरीके से रिस्पॉन्ड नहीं करते, स्पेशली क्रॉनिक बीमारियों में, तो a lot many times it takes a toll on the doctors, even though with their training, exposure, discussion with seniors, they are tuned to it, to recognize it that they are not gods, they are only God's hands. But their own expectations with the of the patients, that the doctors can bring about some miracles, all leads to a lot of pressure, to which sometimes doctors also succumb. So this pandemic, which just went by, was also one such mega event which kept the healthcare fraternity in like a pressure cooker environment. They didn't know which medicine is the best, what can be done, what doses are appropriate, because it was so new, without much precedence. And we all saw that sometimes the doctors also were helpless. They also lost their near and dear ones. During pandemic, we had so many reports on the TV that the healthcare workers are staying separate from their families and doing their best, what is possible with the patient. So yes, stress took a big toll during the pandemic. And also the other area which you mentioned, when doctors come under attack of the public. So that has also started to play on the minds of doctors, that we try to help the patients to the best of our ability. But if we are not able to, then it is not that uh, we should be attacked or we should be beaten up.
Right.
So yes, both these instances have led to a lot of mental health issues in the fraternity.
But you know, a lot of times doctors also believe, yeah, people also believe that there has to be a pre-existing medical condition, pre-existing mental health conditions, जिसकी वजह से they are more prone to certain disorders, certain health issues. What do you feel about that?
So you see, every person has a personality.
जी,
Personality means how a person sees a particular situation, understands it, and reacts.
right,
And when you are in an pressure cooker situation all the time, so it usually brings about the negative aspects of your personality to the fore. So उस वजह से बहुत बार ऐसा होता है कि पर्सन का ब्रेक डाउन हो जाता है, या उसके बिहेवियर में चेंजेस आ जाते हैं, या ऐसा लगता है कि वो बदल गए हैं. तो प्री एग्जिस्टिंग डिसऑर्डर्स जरूरी नहीं है कि हो तभी ऐसा होगा, बट यस, पर्सनालिटी डेफिनेटली प्लेज अ मच बिगर रोल.
do you feel young resident doctors are more prone to this as compared to experienced and seasoned doctors?
So all the seasoned doctors were also at one point of time young doctors. So they have gone through the furnace and they have come out. But it is all about what kind of society you keep, what are your support structures. A lot of doctors come from doctors' families, so they have a different kind of support structures. Whether you have friends to share things among yourselves or not. So what is your support structure in terms of friendships, relationships, family? That matters a lot, whether you are young or whether you are old. Okay. So if you have a good support structure to share with, to guide you, I think it helps a lot in coping up with things.
You know, can management and coping up with certain stresses in life, particularly for healthcare workers, do you feel that treatment, like seeking treatment, is difficult for them because they're quite hesitant कि हम अपने hospital में नहीं दिखा सकते हैं या अपने colleagues को नहीं दिखा सकते हैं. So how is the ideal way they should go about seeking treatment and management?
So we have to understand that stigma which is attached to mental health sphere is much more in the medical fraternity, it seems, than the general public. While after post-pandemic, people have come forward and sought treatment for their ailments, their difficulties. But I think when it comes to the health fraternity, the stigma is still a lot. So definitely they feel hesitant in going to their colleagues in the same working place. But at the same time, now psychiatrists are available in each city, or they're widely available. So the help should be sought. They should not try to treat themselves on their own, self-medicate, or just rely on substance abuse to drawn out their issues, because the relief is going to be very temporary. And once it is like you are entering a chakravyuh. You may start things, but how to go about it and when to finish it, it's going to be a difficult affair. So it is always better that you seek out a psychiatrist's opinion whenever you are facing any issues. And psychiatrists are deeply committed to the privacy, whether it is regarding the healthcare workers or even the general public. Usually, issues and cases are not discussed with anyone. And even in the medical fraternity, the identification when a case is discussed is not used. So a lot of emphasis is given to that to this thing, that everything what you discuss with your doctor or your psychiatrist is private.
A lot of times, then treatment management is done with healthcare workers, with patients in general. So, अगर हम management की बात करें, a lot of times the reasons behind their difficulties can be sometimes out of their control. Sometimes doctors may feel that they are not being, their talent is not being recognized by the hospital. So, at a managerial level, at a management level, how do they get that job satisfaction?
You see, most of the doctors who are practicing,
Right.
they basically enjoy the challenge of helping others, of solving the health-related issues.
Right.
But at the same time, sometimes they get overworked, or rather, most of the times they get overworked. And so, because of which they are not able to take care of their own personal life, their family life, or keep friendships. So, which all takes a big toll on their mental health. With less time at hand, it becomes very difficult to give time and space to self and other important people in your family, which leads to a lot of mental health issues, relationship issues. So, at the level of management, it is also crucial that adequate staffing is done, adequate resources are provided to the doctors so that they don't get burnt out, which could happen easily and very frequently because of the nature of the work. So if adequate resources is given, adequate junior staff is given, then definitely we can make a dent in it. They can be helped. So that is for the management to look into.
What are the signs and symptoms doctors or healthcare workers in general should look out for, that this is the time I should go and seek help? Yeah, managerial staff or management of a hospital should look out for their workers. What are the signs and symptoms?
So the signs and symptoms are usually the same as in any other person. If a case of anxiety is there, the person might feel palpitation, might feel stressed, lack of sleep is there, a lack of appetite is there. Okay. So gradually they overcome, but if they are not able to overcome, then definitely help is available. Same is the case with depression. If things are overbearing, if you're not able to cope up with the stress, you feel sad, you feel like crying, uh, you're not able to sleep, guilt feelings are there, then definitely you should seek out help. Okay? And especially, I would like to mention that nowadays, the kind of medicines which are available to us are very different from the kind of medicines which they might have learned or been exposed to during their psychiatry residency period or during their MBBS years. There are far more medicines which are non-sedative, which allow people to keep on working while they are under treatment, which even if they restore the sleep, they don't lead to hangover the next day. So these are also the issues which prevent doctors from seeking help. So I would like to say that yes, psychiatry and psychiatric medicines have moved a lot further, and we are able to provide a much better quality of life with the kind of treatments we have now.
Thanks so much, Chandok. Thank you for sharing these thoughts with us. And I hope all the healthcare workers can understand and recognize the importance of mental health and seek help if there need be. Thank you so much. Thank you, viewers.
Thank you, Pallavi. Thank you, viewers. Bye-bye.
Bye.